you look everywhere from her hair all the way down to her neck, she has too much skin and it's hanging. Hi, this is Dr. David at Magnolia Skin Center, and I can't wait to show you a regenerative journey of my nurse at Magnolia Skin Center, Eileen, Nurse Eileen. Come in and meet Nurse Eileen. Okay, so let's jump right into it. So this was Nurse Eileen 2 years ago at age 64, and I've got a few things pointed out. Okay, now which we're going to come back to. I'm just going to give you the spoiler alert and show you Nurse Eileen right now at age 66, 2 years later. Oh my God, that could not possibly be the same person, but it is. Okay, so let's go back here and see a few things to point out here. I've drawn a blue arrow to the bags under her eyes. That's because the skin there is thin. It's lost its ability to hold back water and a fat pad. I didn't put an arrow above it on it, but if you look at her eyes above the lash line, she's got hoods. She's got low brows. In general, if you look everywhere from her hair all the way down to her neck, she has too much skin and it's hanging, or what we would call laxity. The red arrows are pointing out the hanging skin over her, what's called her nasolabial fold. You can see how it's just kind of folded over because it's too much. It's just hanging. And then I have a green circle around the jowl, or what we call the pre-jowl sulcus, where everything is hanging. If you looked at her from the side, you literally couldn't see a jawline because all the stuff is hanging over the tissue. We did a combination of a bunch of different therapies. Okay, so when you come in, we'll do a consult on you and see what your solution should be. Okay, but there's Agnes Injectable Radiofrequency, which is a very sculpting technique, which shrinks and shrink wraps and lifts and tightens and regrows your fibroblasts and get you healthy young skin back. We use thulium lasers. We use selinous derma PRP. We use PRX biostimulatory treatments. We have all kinds of technologies and modalities. So we used all this on her to achieve this result, which is what she looks like now. Look at the lift. We talk about the inverted triangle of beauty. See how she had sort of become the jowly pear where everything's hanging at the bottom, and now we popped her back to the inverted triangle of beauty. If you go back and forth, it literally looks like low goes back up to high. It literally restores the volume and lifts, shrink wraps everything. Look how the skin has gone from dull, which doesn't reflect light, to healthy skin, which reflects light, has its blood supply, thickened skin with volume. The bags are gone. There's just really no comparison. Okay, one more last look at old Eileen, who was 64, and now young Eileen, who's older but looks younger. Look at that, reverse aging. So we can't wait to see you at Magnolia Skin Center. This is Dr. David. Bye for now.